Hello, everyone. We're going to get our presentation started. Feel free to use the chat box during the presentation, and afterwards we'll answer as many questions as we can. Good morning and welcome to the 2021 Epilepsy Expo. I look forward to meeting you all next year when we can hopefully do this in person. But for now, we will meet each other virtually. If you have any questions that pop up, please feel free to use the chat box. So, an introduction to me, I came to UCI as a new grad nurse. I was hired onto the neuro step-down unit at UCI. So I have been a neurology nurse for the last 5 years on our epilepsy monitoring units and have recently transitioned to the role of nurse navigator for the comprehensive epilepsy program here at UCI. So in addition to helping treat patients on the inpatient side of things, I also have the pleasure of speaking with them and helping them on the outpatient side. So the purpose of an epilepsy monitoring unit is to help us to have patients undergo prolonged EEG monitoring. So the EEG helps us to characterize episodes, determine if they're epileptic or non-epileptic, and direct treatment programs that would be appropriate, whether that be medical treatment programs or surgical programs. For surgical candidates, the intracranial monitoring can help us map the brain so that we can determine the safest and most effective surgical options that we could undergo to help control or eliminate seizures. So 2 types of EMU admissions can happen on our unit. The first one is the phase 1, which is the external electrodes. These are non-surgical. They are electrodes that are pasted to the scalp and held in place with netting. And then the phase 2 is intracranial monitoring. So patients undergoing phase 2 monitoring actually go to the OR on the morning of admission, and electrodes or grids are surgically placed by our team of neurosurgeons. This is an invasive test. We typically only offer it after a patient has done the phase 1 study and their seizures have been determined to be epileptic. And we know that doing this phase 2 will help us narrow down where the seizures are coming from. So the actual EMU unit is located on our neuro step down, which is DH56 at UCI. This is a 15-bed unit. 6 of these beds are dedicated and equipped for our EMU patients. The ratio on that floor is 3:1 patients to nurses. And other specialties that are treated on that unit include stroke, TBI, and movement disorders, as well as any other thing you can think of that would be neuro. Here's an example of one of our epilepsy monitoring unit rooms. So as you can see, looks like a standard hospital bed. We also have continuous access to suction and oxygen if the need arises. What makes these rooms different is, as you can see in the middle, there is a microphone and a camera mounted to the ceiling. So this allows us to have continuous audio and video recording throughout the EEG so that we can correlate your clinical manifestations of seizures with what's going on with the EEG readings. So in simple terms, that means that if you have a lot of motor activity that looks like a seizure, we can look on the EEG and figure out where that's coming from and what it looks like and how we can best treat it. And then on the right-hand side is the box where the EEG actually hooks into. So this allows for remote monitoring and continuous access to your EEG throughout the stay. So most admissions on our EMU are 3 to 7 days. Medications likely will be held, if not titrated down, to allow for increased seizure activity so that we can capture what kinds of activity is going on. We also may try other methods to induce seizures, such as photic stimulation, which is commonly known as strobe light therapy, hyperventilation, sleep deprivation, where we have you sleep for 4 hours at a time, and then other personal triggers that might work for you specifically. So we've had patients who, when they smell something or hear something, that tends to induce seizures. So if you've got anything that's kind of personal to you that causes seizures to come on, we might try those kinds of methods so that we can capture that activity and read the EEG and figure out how to help. The morning of admission, you'll go up to your room. For the phase 1 studies, a specialist tech will apply the EEG electrodes. A nurse will obtain IV access and give you orientation to the DH56 units. And then our team of epileptologists will discuss your history, what types of seizures you have, how often they occur, what triggers them, what kinds of medications you're on, and they'll discuss the plan of care for the week so that you know what to expect. And then at discharge, the team is going to give you a list of instructions so that you have something written that you can refer to when you go home. It'll tell you exactly which medications we want you to stay on, what dosages. If we order further testing, such as an MRI, it will list that there, and then any future appointments that we have scheduled with you. A few days after your discharge, you'll be given a call just to check in, make sure that everything's going well, you're doing okay after you left the hospital, and see if you have any questions. So some helpful hints that I have gathered over the years: make sure that you wear comfy clothing. You're going to be confined to this room for a few days. You want to make sure that you're not wearing anything that's going to be uncomfortable. And bring your favorite pillow and blanket, because the pillows are hard to come by and the blankets are not thick. And you know those hospital rooms can get cold. So comfort is the key. And then make sure you have plenty to do. We do have full cable and 60 on-demand movies, but I see a lot of people like to bring their tablets or computers and watch Netflix. I also suggest bringing snacks with you, non-perishable snacks. So chips, crackers, things like that. We have a full menu, but it's always nice to just reach over and grab that bag of cookies that you really like, treat yourself. And then the last thing is to make sure you bring your chargers. Those are almost impossible to come by on the unit. So make sure that if you do bring your laptops, computers, phones, that you have a way to juice them up so that you don't lose your entertainment source. And that's about it from me. If you have any questions, like I said, please enter them in the chat box. It was a pleasure speaking with you today, and enjoy the rest of the expo. Hi, everybody. I'm happy to take any questions that you have. I'm sorry the audio was a little bit hard to hear. But if there's anything that you have questions on, just let me know and I'll answer to the best of my ability. So we're asked a question: how many days in the EMU? Our typical stay is about 3 to 7 days. It just depends on how much activity we're able to get while somebody is in our EMU. We need enough seizures to be able to make an informed decision on treatment options. So typically I see people come in on Monday morning and leave by Friday or Saturday. Occasionally we'll have extended stays if someone really hasn't had enough activity for us to make a good decision on treatment options, but that's pretty rare. And then as far as insurance options go, if you want to get referred to UCI, we do have 2 ways to do it. For patients with PPO insurances, you have to get all of your medical records from your provider and bring those in with you so we can take a look. For HMO, we actually need an official referral from your provider in order to be able to look at your records, and then typically they'll send those over to us. Someone asked about visitors. So our visitation during COVID is a little bit limited. You're allowed 2 visitors between the hours of 11 a.m. and 6 p.m. They must show proof of vaccination or negative COVID vaccine within 72 hours. But we do see people coming in to visit their friends and family, which is very nice, especially after so many months of not being able to do so. So someone asked about walking around the unit. So because you're hooked up to the EEG and the wires are hooked into the wall, you're able to walk around the entire room. There's quite a bit of leeway with the wires, but you won't be able to go out in the hallway unless the leads are disconnected for any reason. So typically we have people walk around the room with assistance, and then we do have foot cycles in the rooms. So you can sit up in the chair and use the foot cycle if you want to get a little bit of exercise while you're sitting there. And it's got different difficulties, so you can adjust that just to make it a more of a workout for you. So as far as the population that we're able to admit with age limits, we typically don't admit anyone who's under the age of 18. We have had a couple of patients who have had an exception for that, but most of the time, our patients are between the ages of 18 and we've gone all the way up to the 90s. So the types of epilepsy that we treat tend to be epilepsy that's untreated by medications. Somebody who's tried multiple medications and they're unable to get their epilepsy under control. Or if there's a question as to whether their seizures are epileptic or non-epileptic, we'll bring them in for EMU so that we can determine exactly what's going on so that we know what to do next. And I think those are all the questions I'm seeing in the chat box. Are there any other questions that anyone has before I hop off? Oh, one last question. As far as medication goes, typically we have people stop their medication while they're in the hospital for seizures. If they're on multiple medications, like say 4 medications, we'll probably taper down one at a time so that we're not causing too much seizure activity all at once. But for the most part, by the end of the admission or towards the middle of the admission, you'll be off your medications. And then towards the end, before you're discharged, you'll be back on your medications to ensure that when you go home, you're safe and not having seizures on the way home. All right. And if there are no other questions, I'm going to hop off. Thank you so much for joining us today. It was a pleasure talking to you, and I hope you have a great expo.